Welcome back. Right now, health officials are tracking Cyclospora outbreaks. It's been reported in at least 18 states, including Texas. The parasite has sickened hundreds and sent some to the hospital with cases linked to contaminated food or water. Dr. Wesley Long with Houston Methodist is here with me to talk about what to look for and more. Dr. Long, thanks so much for joining us this afternoon. And first of all, I've got to ask, for folks out there who aren't familiar, what is Cyclospora?
So, Cheryl, Cyclospora is a human parasite, and it's spread via infected individuals via their feces, so through contaminated water. And typically what winds up happening is it's contaminated raw produce, raw fruits and vegetables, either being contaminated at the source of harvest or being contaminated during processing in the food chain, and then being purchased by individuals who then contract the illness.
So is this, say, when we go to get fruits, vegetables, and we're not washing them before we eat them?
Correct. So the Cyclospora parasite itself is resistant to chlorine, so it's resistant to a lot of some of the automated washing and processing that gets done. It can also be spread, via people who are infected via their hands, and so you just want to make sure with the fruits and vegetables, especially while the CDC is trying to figure out the source or sources of the outbreak. You want to make sure you're washing your fruits and vegetables as best. Washing your hands first off with soap and water, and then washing your fruits and vegetables as best you can. Also, if you're not eating them raw, if you can cook them to high temperatures, that will kill the parasite as well. But for raw fruits and vegetables, they just need to be washed to the best of your ability. That's really the best defense against Cyclospora.
What's the best way to do that? Just water? Do we need a special veggie wash? What do you recommend?
I recommend people using what they have on hand. Again, you want to make sure your hands, first off, you want to make sure your hands are clean, right? Whoever's preparing the food needs to wash their hands with soap and water. And then I think, if you have water, if you have veggie wash, if you have a light soap, something you can use, it's tricky, again, because a lot of these fruits and berries and things have very rough surfaces. So you're just really trying to do your best to clean them as best you can and go from there. For people who are immunocompromised, may need to take extra precautions and should talk to their healthcare providers about that. But you just really need to do your best job to wash those fruits and vegetables if you're not going to be cooking them.
And Doc, why are we seeing more cases in the summer and spring months?
So Cyclospora is typically seen in the spring and summer months, likely because these are the times when we're harvesting a lot of fresh fruits and vegetables and then consuming them, across the U.S. So it's a very seasonal parasite, and likely in part just due to the sort of patterns of when these produce and fruits and things are harvested and then consumed across the U.S.
When is it serious enough to seek medical care? What types of symptoms are something that we can treat at home? And when is it time to get to an urgent care?
So I would say, this generally is going to cause a very vigorous and watery and crampy diarrhea that's very unpleasant, as long as someone is able to, basically stay hydrated. And if they're otherwise healthy, it's probably something that could be managed at home. If the symptoms go on for a prolonged amount of time, if someone feels like they're not keeping up with the hydration status, if they're starting to feel dehydrated, those would be times to reach out to a healthcare physician or clinician provider. And then also, if you're immunocompromised or immunosuppressed, this would be something you want to talk to your physician about, being extra careful or maybe getting extra assistance in those cases.
Dr. Long, are those symptoms similar to what you would experience if you've gotten food poisoning?
They're very similar to a lot of different causes of food poisoning. So it's going to be very difficult for someone to know if they have Cyclospora or not, unless there are very expensive molecular tests available, but most individuals don't need those tests. Otherwise healthy individuals, but most people aren't going to be able to tell the difference between Cyclospora or a lot of other causes of food poisoning that just cause this sort of watery, crampy diarrhea. And there are several different bacterial causes of that as well. The other sort of issue with Cyclospora is that it has a week-long incubation period. So if you eat something today that makes you, that is contaminated with Cyclospora, you're not going to have those symptoms until, perhaps as late as next Thursday or Friday. So it's difficult for people to remember. It makes the investigation for the CDC harder because it's difficult for people to remember what exactly they ate several days, 5, 6, 7 days, 8 days. The incubation is a little variable, so it just makes it hard for people to remember what they might have eaten.
All right, Dr. Wesley Long with Houston Methodist Hospital, thank you so much for joining us with those important points on Cyclospora. A lot of folks not familiar with it, but something we definitely need to know about, and so important always, regardless, to make sure you wash your fruits and veggies before consuming them. Thank you so much, sir, for that insight.
My pleasure.